Today we are launching another useful tool that can supplement the critical detective work we are conducting in public health. Alberta TraceTogether is a voluntary, secure, mobile contact tracing application to help prevent the spread of COVID-19. You only need to download the app and provide your mobile phone number to register. The app is now available to all Albertans in the Google and Apple app stores. Let me tell you how this app will help us prevent spread. Through the process of contact tracing, public health workers currently identify who may have come into contact with a person infected with COVID-19 by asking questions of the case and relying on their ability to remember everywhere they have been in the past several days and who they were near. These people, their contacts, are then called to find out if they are sick and to make sure that they stay home for 14 days from the last exposure, even if they are feeling well. This is a vital step in preventing further spread of the virus. It is also time-consuming and resource-intensive, relying on each individual's ability to recollect who they may have come in contact with, and then follow up with each of those individuals in order to be successful. When a contact tests positive for COVID-19, they become a case, and the contact tracing process is then repeated to identify, test, and isolate their contacts as necessary. Contact tracing, when complemented by aggressive testing, can help us interrupt ongoing transmission and reduce the spread. The faster Alberta Health Services contact tracers can inform exposed people or close contacts, the quicker we will be able to prevent potential outbreaks and identify when Albertans must self-isolate. In addition, these tactics yield valuable data that can help us get a better understanding of how the disease is spread and what underlying factors can contribute to cases of severe disease. Like bringing a camera into focus, these techniques give us a far clearer picture that help us to inform our actions going forward. Alberta TraceTogether relies on the use of wireless Bluetooth technology to log interactions as an encrypted digital handshake. This happens when two phones, which each have the app, get within 2 meters of one another for an overall total of 15 minutes within a 24-hour period of time. In the event someone with the app tests positive for COVID-19, they will be asked to allow contact tracers at Alberta Health Services to use this information to further enhance manual contact tracing, and allow other app users to be contacted so they can be informed if they have been potentially exposed. Even when app users who may have been exposed are contacted, user identities will not be shared. Users will merely be informed that they have come into close contact with someone who has tested positive for COVID-19. Previously, public health professionals at Alberta Health Services would have no way to know about the encounters of a COVID-positive patient if they cannot recall them, or if they may have come into contact with persons who are unknown to them. Now they will, and they can contact that person and let them know they may have been exposed to COVID-19. The use of technology for this purpose may seem intrusive, but downloading the app is completely voluntary, and data will not be accessed unless a user provides consent to share their data with AHS. The app does not use your phone's GPS and does not track the user's location or contacts. The only information exchanged between users' phones is a random ID that is non-identifiable. Nothing that is identifiable is exchanged. Data is stored on your phone in an encrypted form for 21 days. After 21 days, each day's worth of data is deleted 1 day at a time. Your information will not be used unless you agree to participate and consent to sharing the encrypted handshakes, those digital IDs, from the last 21 days. If you were diagnosed with COVID and you consent to the information on your phone being used, the contact tracer will be able to match the unique, non-identifiable IDs on your phone with the registered user's phone numbers via a merging of data. This is the only information you are asked to provide, and providing this information voluntarily is crucial to our work to prevent the spread of COVID-19. I would like to report an additional 218 cases of COVID-19, bringing the total number of cases in Alberta to 5,573. Of these, 2,359 people have now recovered. Since my last update, we have also confirmed 3 additional deaths in the province. This brings the total number of lives lost to 92. All 3 deaths were in continuing care facilities experiencing outbreaks, which is a reminder of why we need to continue to be vigilant to protect this population. My thoughts and sympathies go to everyone grieving the loss of a loved one today. We should never let these numbers become just another statistic. As of today, there are now 580 COVID-19 cases in outbreaks in continuing care facilities across the province. An outbreak has also been declared by Alberta Health Services at the Amazon Fulfillment Facility in Balzac, where additional measures have been put in place to prevent spread. 5 cases have now been reported at that facility, although it is not yet clear if all 5 are linked with a common exposure. We have just received this confirmation, so it will not be reflected in the outbreak listing on our website today. In addition, 2 positive cases have been identified at Alpha House in Calgary, where a rapid response team is now supporting that location to put outbreak measures in place. At High River's Cargill meatpacking plant, there have now been 921 cases. There have also been 390 confirmed cases among workers at the JBS plant in Brooks. So bringing this all together, I can distill 2 key lessons for Albertans. One is the importance of everyone monitoring ourselves for COVID symptoms, and should they occur, isolating yourself until they disappear, and going online to arrange for a COVID test. I know I keep repeating this message, but I cannot overstate how critical this step is to protecting the health of those around you. So I encourage all of you to be mindful of what your body is telling you and stay home if you have a cough, fever, runny nose, sore throat, or difficulty breathing. Our investigation into comorbidities also has some important takeaways that Albertans can practice. Sadly, age is a predominant factor in severe cases, and there is little we can do to change that except for protecting those who are older. But we also know that many of the conditions associated with COVID-related hospitalizations and deaths in younger people are things that can be addressed. Factors such as smoking, obesity, high blood pressure, and diabetes are all conditions where supports and management options are available to Albertans. Eating healthy, exercising regularly, and quitting or reducing smoking are things we can control that may help reduce our risk of experiencing the most severe aspects of this virus. But just as importantly, these are positive, rewarding behavior changes that can greatly affect our health over the long term, from even more deadly complications such as heart disease, stroke, and cancer. I encourage every Albertan to take an active role in their health and our collective health as we respond to this pandemic.